Good morning. My name is Edward Malin. I'm a surgeon working with patients with breast cancer and skin cancer, and I'm the Chief Medical Officer for MediGuide. And I'm pleased to announce and begin this webinar, which highlights the partnership between MediGuide and Children's National Hospital. We have an excellent panel here today. We'll have representatives from Children's National to discuss some of the exciting things that their organization is involved in. We'll have Kara Connor, Senior Vice President of Clinical Operations at MediGuide, who will go through a case study as well as talking about the services that MediGuide provides. We'll hear from Dr. Holly Meany, the Director of the Solid Tumor Program at Children's National, who is an esteemed pediatric hematologist and oncologist. Let me begin by introducing the Executive Director of Global Services at Children's National, Soraia Angiuoli, who hails from Hopkins approximately 3.5 years ago before she joined Children's National Hospital. In her current role, she's responsible for the growth and strategic planning for the development of this program. Soraia, thank you very much for joining us.
Perfect. Thank you. Thank you, Dr. Malin, for the introduction. Thank you for partnering with Children's National, having MediGuide and Children's National have this webinar for our participants. And thank you for all the participants that are joining today to learn a little bit more about the partnership between Children's National, MediGuide, and really hear from Dr. Meany on the latest advancements we have here at Children's National with oncology. So as Dr. Malin mentioned, I'm Soraia Angiuoli. I lead the Global Services Division at Children's National. And Children's National is a pediatric hospital in Washington, D.C. We're at the heart of Washington, D.C., the only pediatric hospital in D.C., and we are the third oldest nonprofit pediatric hospital in the United States. So we have a 150 years history of providing care to children, not only in the Washington, D.C. region, but regionally, but also internationally. Our hospital has 323 beds currently, and we have more than 30 outpatient locations throughout the Washington, D.C., Northern Virginia, Maryland region. And we have a level 1 pediatric trauma center. We have our own critical air and ground transportation, and also our own transportation teams that goes and picks up patients from those far locations and brings them to Children's National for care. And we have more than 75% of Children's National research funding coming from federal agencies, including 70% coming from the NIH. So we have a very strong and robust research arm here within Children's National as well. Next. Children's National was ranked as number 5 in the nation on the U.S. News and World Report, and in the classification of the best children's hospitals. And we ranked in every specialty ranked by the U.S. News and World Report. Here on this slide, you can see the top departments that we've been ranked at in Children's National. And I want to highlight our presentation today will be with oncology and cancer. And you can see here, we ranked in cancer as number 4. So out of all the pediatric hospitals in the nation, our cancer program was ranked as number 4. And you can see diabetics, number 7, GI, number 8, neonatology, number 2, and so forth. Next. Here's a little bit of the history of Children's National. We opened in 1870 with about 12 beds. So the hospital started after the Civil War, supporting the orphans in the region with 12 beds. And then you fast forward to today, 150 years stronger. We are now a hospital with 323 beds and continue to grow. For the Global Services Division, the international arm of the hospital, we were able to support our first international patient in the middle 1990s. And that's when our department, the international department, has been launched. And in 2022, through the Global Services Division, we launched the Remote Second Opinion Program, which is part of the partnership that we currently have with MediGuide. Next. Here's a little overview of the Global Services Division, the international arm of Children's National. Our team supports and cares for patients coming from all over the world to Children's National for care, and we support with any needs that the patients might have pre-travel and supporting on understanding what their clinical needs are and what appointments they will need when they come to Children's National for care. We do all of their care coordination, and we also provide them a coordination on navigating the hospital, navigating the departments, but also language and cultural assistance as well. Currently in our office, we provide 24/7 support. So we have team members that are on call to support the needs of the patients that are in the United States receiving care. Also, as part of the international department, we have the remote second opinion program. Next. The remote second opinion program offers the expertise of our international, our physicians at Children's National to international or domestic families that are not in the Washington, D.C. region without them having to travel to the United States or to our hospital for care. So the remote second opinion is very important because it really expands the reach of Children's National to patients that either can come to the United States for care, or really they just want to confirm or make sure that the diagnosis that they're getting in the home country is similar to what they would get at Children's National. The process is very simple. And let's say you're coming through MediGuide. MediGuide will then collect all the information, all your medical information, pass it to us at Children's National. We will then select the best expert to review that information and those medical records that we received. Our doctor will write a summary. That summary will become part of our medical records at Children's National. So let's say 5 years later, that patient ends up coming to our hospital for treatment. We will have that initial remote second opinion and all the documents that were shared with us in our records, in our medical records. And then once that letter, that opinion is generated by our physician, MediGuide and their physicians are also connecting with the patient, with the client at the end of the day, and making sure we are looping all the information. And if necessary, we can do some follow-ups after that remote second opinion has been provided to the patients. And I'll pass it now to Kara, our colleague Kara, that works with us and worked very, very close with me and my team here at Children's National of making sure that this partnership flourished. So Kara, on you, thank you for allowing us to have this webinar. Mm-hmm.
Oh, of course. I'm delighted to be here. So hi, everybody. Good morning, good afternoon, good evening, depending on where you're joining us from. Thanks so much for calling in. I'm Kara Connor, and similar to Soraia, delighted to be here to take part in this webinar between MediGuide and Children's National. I'm a registered nurse in the US, and I've been working with the incredibly talented clinical team at MediGuide for the past 9 years, and have had opportunity to help people from all over the world gain access to the most up-to-date clinical information available to them for their specific condition. I've been working in medical second opinions for about 15 years. And prior to that, I worked as a staff nurse at Mass General Hospital for about 10 years. And that's one of the Harvard teaching schools here in Boston. And I'm super proud of MediGuide, and I'm very connected to its mission. And happy to be here and part of this team. So what do we do? What does MediGuide do? Thank you. We specialize in expert medical second opinions, meaning we provide clarity and confidence to help our patients or our members make informed healthcare decisions. Pretty simple, right? So if a patient is diagnosed with a new healthcare concern, or if it's someone who's managing a chronic condition, ensuring that the medical diagnosis and treatment plan is accurate will clearly have a profound impact on the outcome that patient has, and hopefully improve its overall prognosis. So basically, in a nutshell, accurate diagnosis and right treatment plans provide better outcomes. Not to underestimate the power of impacting someone's decision-making when they know that they have the confidence that they're doing the right thing. So even at times, if there's not a profound impact on a change or a diagnosis or a change in treatment, providing people the ability to know that what they're doing, in fact, is correct, and I'll tell you a little bit more about that in a minute, provides massive peace of mind and definitely makes people feel confident moving forward. And then setting us apart, I would say very simply, is relationships, and our valued relationships. So first and foremost, one of them being Children's National. We have a network of world-leading medical centers, Children's National being at the top of that for kids, that we work with, that are in our network, our partnership. So we were able to provide our customers and our members access to these medical centers in their times of need. So a very, very unique position in our space. It's not one provider providing opining on a condition. It's an institution, which enables us to deliver a more holistic result to our patients and members. And again, personalized case handling. So we have a staff of amazing registered nurses that are working with our patients every day, and it's a dedicated relationship. So it's one person, one contact throughout the process, which makes it a lot more comfortable and helps kind of ease the fear a little bit of what the patients are facing at that particular time, having this special relationship that's formed over the course of a few weeks. And an extension of that is our local partner network. So although MediGuide is headquartered in the US in Wilmington, Delaware, we have a global footprint and operating in over 45 countries across the globe. So in order to make that successful, we have a very extensive local partner network that help us organize cases and manage members local in their own country and their own language and on their own culture. So that's incredibly helpful. So I think that we have an advantage of having these great relationships and all these tiers throughout what we do in our business, and sets us apart. A little background on MediGuide, just briefly. Established, we've been around a business since 1999. And like I said, our specialty is medical second opinions. We also help out with some telemedicine and have other products where we help patients sort of navigate from one place to another if they're having, they want to travel for care, for example. And we operate globally, like I said. So focusing on our partnership and our relationship with Children's National. So it's an honor. The staff is just really, they're so organized, professional, efficient, and knowledgeable. They make the process easy on us, which is amazing. And we also get to help the kids in our client base from all over the world have access to these amazing specialists and state-of-the-art treatment recommendations. So couldn't be happier to be in a partnership with Children's National. So we've been in a relationship for about 3 years, which is great. We're going to continue to build on that. And we have this goal that we set that we can turn around a case, a medical second opinion for a patient, for a member, within 10 business days. And Children's National definitely provides that to us under that timeline, which, all things considered, we don't send them straightforward cases. We don't send them like as something simple. They're very complex and they have a lot of they require a lot of attention. So to meet that metric is incredibly good. So I appreciate that very much. And satisfaction can't get better than that. So all of our patients that work with Children's National, 100% of them say that they would recommend the service to a friend or family member. So fantastic. And thank you all for being such great partners. So a little story here, just to share with you what it is we do. Tell a little story about a patient that we did send to Children's National as a remote second opinion, so not physically, and as a way to sort of think about this. We wanted to share a story, so it was more personalized. So this is about a 6-year-old little girl. She's 6 years old now, but in 2020, when she was just 2, she presented with a febrile seizure to her treating physician after a virus she had at home. So there was a workup done and a scan of her head, which revealed initially what they thought was craniopharyngioma, which is a benign tumor of the pituitary gland. So the thought at that time was that the seizure was not related. So this was an incidental finding. And the treating team recommended surveillance. So essentially have a repeat scan of her head, of her brain, for every 6 months for a period of 2 years to monitor any changes, any growth. And that was the plan at that time. So at the same time, in parallel, Anna started to develop some headaches. They were intermittent, not consistent, but they were enough of an issue that in 2022, they repeated the scan, which did show some growth of the tumor, and it was believed to have spread to closer to the optic nerve. So due to her young age, they were looking to see, she wasn't quite 4 at this time, and they were trying to understand whether or not it was affecting her optic nerve enough where she was maybe having some visual disturbances. But based on her age, it was really hard to understand that. However, because her symptoms did continue, in December of 2022, so later that year, a biopsy was conducted. And there was a lot of anxiety around this because where the tumor was located, there was risk there, right? Risk to her sight. And it was a very stressful time for her family. However, it did change the diagnosis. So once the results were back, the diagnosis changed to a visual pathway glioma. Surgical removal was risky and is risky, as well as the biopsy, like we just discussed. So there was a lot of concern about that, of maybe the potential loss of sight for this child. So the recommendation at that time was to consider chemotherapy. Parents were very nervous, felt scared, didn't want to put their 4-year-old through chemotherapy or surgery, to that matter. So continued to watch and wait. By January 2024, so just this year, her symptoms increased again in severity. A repeat scan showed growth of the tumor again, and additional increased symptoms of visual changes and headaches. So based on this, Anna's treating team recommended to start chemotherapy at that point. No more surveillance, no more watching and waiting. Very, very frightened. Her parents and family was at that time. They really needed further assurance that this was the right thing to do. Luckily, her parents had our benefit through their insurance plan, and reached out to us to explore the best treatment options for their daughter. So they were lucky enough and fortunate enough to work with Kristen D'Angelo, Director of Clinical Operations and Nurse Case Manager Extraordinaire. And she helped them not only collect all of the medical records and information, she worked with them to figure out which facility within our network would be best for Anna's case to be reviewed. And they decided to go with Children's National, and I support that decision. So the case was assigned to Dr. Roger Packer, who is the director of the Gilbert Neurofibromatosis Institute and Brain Tumor Institute at Children's National. Dr. Packer and his team reviewed the case, all of the medical records and imaging, including pathology, and endorsed the chemotherapy plan without additional therapies. So no surgery, but do start the chemotherapy, which she did start in April. And everything is going really well so far. And her parents are just incredibly grateful and relieved to know that the plan they have in place is correct. As you can imagine, if you have a child facing such terrifying circumstances, the peace of mind is just unparalleled. So they are grateful. And this is one of those cases where even if you don't impact a change directly, providing someone or people or parents that type of peace of mind is just amazing. So thank you to Children's National, and thank you to everybody for listening and sharing this story with me. And I will pass it back to Dr. Malin.
Kara, thank you very much. That story really captures how this partnership can change lives and provide the necessary care that patients need. Just a brief overview of my experience. I've been in practice as a physician for more than 20 years. I have particular expertise in surgery and experience in trauma, general surgery, burn surgery. I also did a fellowship in burn critical care and currently specialize in reconstructive surgery with emphasis on breast and skin cancer. Over the last year, I've been a part of MediGuide as their chief medical officer, and I've been excited about what MediGuide and its staff offers. On behalf of the staff, the CEO, executive membership, I'm very pleased to introduce our next panelist, Dr. Meany. She's associate professor at George Washington University. I am a graduate of GW, and I spent many rotations at Children's National, so I know the excellent work that they're doing there. She graduated from medical school at Ohio State University and completed a pediatric residency in Columbus, Ohio, following which she joined the Children's National Fellowship, focusing on hematology and oncology with a dual program conducting research at NIH. So on behalf of our staff, Dr. Meany, I'm pleased to welcome you to the webinar.
Thank you so much for the kind introduction. It's really lovely to be here, and it is my pleasure to represent the Division of Oncology in the Center for Cancer and Blood Disorders at Children's National. Within oncology, we have three primary teams: our leukemia lymphoma team, neuro-oncology team, and the solid tumor team, which I lead, all of whom work very closely with our bone marrow transplant team. And in addition, we have an experimental therapeutics, a cancer genetics, a cell therapy, and late effects programs, which really allow us to offer novel therapies to our patients and cutting-edge care. Although my focus will be on the oncology program and specifically our solid tumor program, I did want to highlight our hematology and stem cell transplant programs. We are all very interconnected, as you might imagine. Our hematology group has one of the largest programs for patients with sickle cell anemia in the country. We are a hemophilia treatment center and a referral center for a variety of other blood disorders. Our patients with malignant and non-malignant disorders are treated by our stem cell transplant team, and these programs overlap with our cell therapy program as well. And that allows us to provide state-of-the-art immune therapy to our patients really across the board. Specifically chimeric antigen receptor or CAR T-cell therapy, antigen-specific T-cell therapy, which is directed as cancer treatment, and also in the treatment of our stem cell transplant patients and their post-transplant infectious complications. Our faculty are international experts in their fields, and we are very active and collaborative with respect to clinical research trials. And this is highlighted by recent enrollment of the first pediatric patient outside of a clinical trial to receive an FDA-approved gene therapy for sickle cell disease, which I think is a very nice example of the overlap of our clinical programs here at Children's. A few additional program highlights within our leukemia lymphoma team. In addition to standard therapy, we have a multidisciplinary CAR T-cell program. This is a very specialized type of immune therapy that has made its way to frontline therapy in some patients with recurrent disease. We use both commercial agents as well as novel CAR T therapeutic products here at Children's. Similarly, our developmental therapeutics program is involved in clinical research through the Children's Oncology Group and Therapeutic Advances in Childhood Leukemia Consortium, again, allowing us to bring new therapies to our patients on a daily basis. We have a comprehensive histiocytosis program and are a member of the North American Consortium of Histiocytic Disorders. Next slide. Our neuro-oncology program is also very active and participates in multiple brain tumor consortium, as you can see listed here. Our faculties are really leaders in clinical research protocols throughout these groups. And this is really a world-renowned multidisciplinary team, as was highlighted by the case that was presented. This group includes our neuro-oncologists, as well as neurologists, neuroradiologists, neurosurgery, radiation oncology, as well as physical medicine, endocrinology. Really, the list goes on, allowing us to provide multidisciplinary subspecialty care to our patients. Next slide. But my home is within the solid tumor team, and I just wanted to introduce our team members to those on the call today. We have 5 attending physicians, Dr. Jeffrey Dome, who is also our Senior Vice President of the Center for Cancer and Blood Disorders, and really an international expert in renal tumors. He is the former chair of the Renal Tumor Committee within the Children's Oncology Group, which is an international pediatric oncology organization. And he's currently the continental president in North America of the International Society of Pediatric Oncology, or SIOP. Dr. Aaron Kim is a sarcoma expert and director of our clinical research program. She is very involved in sarcoma research, particularly clinical trials focused on malignant peripheral nerve sheath tumors, and really a very well-funded investigator within our organization. Dr. Linny John is our rare tumor expert. Dr. Amy Hunt is a physician scientist, and her research is focused on novel immune therapies. And then myself, I have a clinical and research interest in patients with neuroblastoma, and as mentioned, lead our solid tumor program, as well as our fellowship training program. Very importantly, we have members of our team that include members of our surgical division. This is led by Dr. Anthony Sandler, and include experts in general pediatric surgery, as well as orthopedic surgery, neurosurgery, ENT, and GI surgery. Our radiation oncology team is led by Dr. Matthew Ladra, and we have a very strong partnership with the Pediatric Radiation Oncology Center. And finally, our team is supported by 2 fantastic nurse practitioners, Amy France and Jessica Stafford, as well as our clinical program coordinator, Kara Vines, all of whom really help us to take outstanding care of our patients and families. Our solid tumor program provides patients really the best standard of care with respect to chemotherapy, surgical resection, and radiation oncology treatment, and we actively participate in clinical research studies. I have listed here several of our partnerships, all of whom really allow us to provide standard treatments, new therapies for our patients with newly diagnosed disease, and experimental therapy for those patients who may have relapsed or refractory disease and really need something novel. And one of our primary partners is the Children's Oncology Group. As I've listed here, we are a phase 1 site, one of 21 centers within the Children's Oncology Group. Some of our other partnerships are listed here with respect to sarcoma research. We're a part of the Sarcoma Alliance. We have a cell therapy and immunotherapy program that is led here at Children's. We participate in industry-sponsored trials and have multiple international and national collaborations, and really excited about in-house investigator-initiated studies. And I'll give you a few examples of those as we go on. Since my love is the neuroblastoma patient population, I wanted to highlight a little bit about that program in particular, but I think there are a lot of parallels between this program and our other solid tumor programs. So this is really just one example of our multidisciplinary approach to patients with solid tumors. We work very closely with our surgical colleagues, as I mentioned, our bone marrow transplant team, radiation oncologists, and these groups work together to really determine the best treatment plan for each individual patient, allowing us to provide the most effective therapy upfront. But we also rely quite a bit on our other team members, including our pediatric intensive care unit and our intensivist team, our palliative care team, interventional radiology for procedures, and apheresis team, which is very important with a lot of our patients who undergo bone marrow transplants. I didn't want to forget to highlight our psychosocial services, which are available and I think really critical for our patients and families with respect to their care. We are really fortunate to have a broad psychology team focused really specifically on our oncology patients. They provide support to patients, to family members, parents, siblings, really encompass all care for the entire family as patients are undergoing treatment. Our social workers are incredible, helping families to navigate the medical system, often helping with aid that might be necessary, as there is quite a bit of financial burden, time burden that comes with cancer therapy. Our child life team works very closely with our patients to help them understand all that is happening, procedures, interventions, medications, the changes that are happening with respect to therapy. We are lucky enough to have art therapy, music therapy, animal therapy, all of which are really favorites of the patients and families at the hospital. We have an education specialist team, which interacts with the patient's school and provides even in-house tutoring, one-on-one tutoring for patients that may not be able to attend school in the typical classroom. And we have a supportive care research team. So not only is our hospital conducting primary research with respect to directed cancer therapy, but also supportive care. How can we decrease side effects and decrease the burden of our treatment? And this is really robust clinical research we're very proud of. I wanted to dive a little bit into the medical side of the neuroblastoma program, and I use this slide in the next to highlight a group of patients with high-risk neuroblastoma. These are patients that have, unfortunately, some unfavorable features related to their disease and have a much poorer outcome despite very intensive therapy. There's a group of patients that we treat quite a bit at Children's National, and the therapy is very intensive and very complex. I think we can provide a lot of support to our patients and families throughout this treatment. So these are patients typically with metastatic disease or other high-risk features. Their therapy spans 15 to 18 months, includes induction chemotherapy, and this is 5 cycles of our typical chemotherapy, the goal being to decrease tumor burden as quickly and as significantly as possible. Patients undergo a surgical resection of their primary tumor, and then they have 2 very intensive rounds of chemotherapy, each of which is a month's duration in the hospital, receiving very strong doses of chemotherapy medication. And as a way to help them recover, they actually receive their own blood cells back to speed up their recovery process. They receive radiation therapy and finally 6 months of immune therapy directed at their cancer cells. This is a standard treatment protocol. As you can see, it's a very lengthy treatment, very involved with multiple types of therapy brought together. As you might imagine, it requires frequent admissions to the hospital, prolonged hospitalizations, both for chemotherapy and to treat side effects related to treatment. And it really is quite a burden on patients and families. But I think with all of the groups I've listed, we're able to provide this care to our patients and families really in a seamless way. In addition to that standard of care, we do participate in clinical research trials, and this is an example of one of the studies that we are participating in with the Children's Oncology Group. So as a member of that group, we have access to upfront clinical trials for our newly diagnosed patients. This is a current phase 3 study looking at the efficacy of novel therapy, immune therapy for patients with high-risk disease who, again, don't have the outcomes that we're hoping for. Again, this is a very busy slide, but I just hope to highlight the complexity of the therapy that we're offering our patients and why perhaps we can be assistance for some of our patients that may need the expertise of a large pediatric center. And I think importantly for our patients with relapsed or refractory neuroblastoma, I listed some of these groups before, but we are able to provide new therapy for those patients who really have a very poor prognosis and also very limited options for therapy. We're involved in many clinical research trials and provide access to care, access to therapies for our patients. I've again listed several of our partnerships within the Children's Oncology Group. As I mentioned, we are one of just 21 core members of that group. Similarly, the Pediatric Early Phase Clinical Trial Network, which is akin to that phase 1 COG group, a small limited number of institutions who are able to offer new drug therapies to pediatric patients. Housed at Children's National, we have a Cell Enhancement and Technologies for Immunotherapy program, or a SETI program. And this really offers ongoing trials for patients with solid tumors, including a T-cell immune therapy trial I'll discuss going forward. This group also has international collaborations. We're working with a group at Dana-Farber and also partnering with a group in the UK to bring new therapies to our solid tumor patients. And finally, we have investigator-initiated clinical trials that are led here at Children's National. And just to provide a few examples of these studies, I wanted to highlight a couple of our trials that we're participating in. This trial is led by Dr. Aaron Kim and is evaluating Thermodox, which is a type of chemotherapy agent, doxorubicin, and it's utilized with MR, high-intensity focused ultrasound, or HIFU therapy in our solid tumor patients. And HIFU therapy is a really exciting new way to target tumor cells. It targets the tumor mass and can kill the cells in a couple of different ways, directly through mechanical injury to the cells, but also has thermal effects. So it, in essence, heats up the tumor cell, and that can cause cell death. This trial is really unique in that it partners the liposomal doxorubicin, which is a heat-activated chemotherapy agent. So the patient receives the drug infusion, and only when that drug reaches the tumor bed, which is heated by the HIFU, the high-intensity ultrasound, is the drug released from the encapsulated delivery system. So it's really a fascinating way to deliver targeted therapy directly within the tumor bed. This hopefully will make the therapy more effective, but also importantly minimizes some of the systemic side effects that we expect to see. The study will look at reaching the maximum tolerated dose and defining what that would be for further study in patients with solid tumors. So a really exciting and novel therapy we have to offer. Similarly, within our cell therapy group, I have a couple of examples I wanted to share with you of some really interesting new immune therapies. This is a T-cell study that Dr. Amy Hunt is leading. The way this process works, or this therapy works, is we do have patients provide a blood sample, and from that sample, we are able to separate their T cells. We take the T cells, expose them to 3 very common proteins or tumor antigens that are expressed on our solid tumor cells, and I've listed those here. Those are WT1, PRAME, and survivin. When our T cells are grown in the presence of these tumor antigens, the cells are educated or trained to target these tumor antigens, so that when we re-administer the cells, these T cells, back to the patient, they will circulate, find any cancer cells expressing these tumor proteins or tumor antigens, and stimulate the patient's own immune system to get rid of those cancer cells. So it's a bit of a way to target the remaining cancer cells. We hope a very novel approach, different from our cytotoxic chemotherapy. We completed a trial using patient-derived T cells, and we did have some prolonged stabilization with this immune therapy. So we were very excited about that hint of efficacy. But one of the challenges with using the patient's own T cells is that it took about 6 to 8 weeks to have the cell product ready for patient administration. And these were patients who had received quite a bit of therapy, so that their T cells were affected by that prior therapy and perhaps not as robust or healthy. So Dr. Hunt's study is actually looking at what we call an off-the-shelf product, where we take donor T cells from patients who have not received chemotherapy. These are healthy donors. We take their T cells, submit them to the same process where they are grown in the presence of these tumor antigens. And then we can, when a patient is enrolled, match the patient to a T cell product. So just like we would match patients for a transplant, we can match them to receive the proper T cell that will be targeting their cancer cells, but not cause side effects or target healthy cells. The advantage of this protocol is that the products are ready to go. We don't have that delay, and the T cells are, again, very robust and hopefully more effective. So this is an ongoing therapy that we have for many of our solid tumor patients. This is the study that I mentioned. It's an international collaboration. So Children's National, as well as a group at Dana-Farber and a group in the UK, are looking to bring a novel CAR T cell product to patients with solid tumors. This is a three-pronged clinical trial, and we are leading one of the clinical studies, which is looking specifically at T cells targeting an antigen called B7H3, which is very common on our solid tumor cells, as well as brain-specific T cells. So looking at two targets commonly expressed on solid tumor patient cells to bring CAR T cell therapy to the solid tumor patient world. CAR T cell therapy is a bit different from the T cell therapy I mentioned, in that these are genetically engineered cells. They've shown a great deal of promise in patients with leukemia lymphoma, but to date, the efficacy in solid tumor patients has been less than ideal. And so with this technology targeting multiple antigens, we hope that we will overcome some of those challenges with CAR T cells in our solid tumor patients. So this study will hopefully be opening in the coming months, and again, is another way to treat our patients, particularly those with relapsed and refractory disease who may have failed all standard cytotoxic chemotherapy regimens. And the last study on the next slide to bring to your attention again is one that's in the works in collaboration with Dr. Tony Sandler, our oncology surgeon, a final immune therapy. You can see this, the theme we have running here at Children's National. These are actually trained T cells. So again, very similar technology to what I've discussed before, but actually the patient's own neuroblastoma cells, the tumor cells themselves, are the source of the antigen or protein expression that we will expand our T cells against. So this is really a way to deliver a personalized medicine approach using immune therapy. And so again, early phases, but the preclinical data from Dr. Sandler's lab is really exciting, particularly in patients with neuroblastoma. So we're very excited to bring this to our patients in the coming months. And so I hope that these examples highlight all of the novel therapies that we have to offer, as well as our partnerships and the opportunities for care of our patients with solid tumors at Children's National, and really appreciate your invitation to present today and your time.
Dr. Meany, thank you so much. That was an excellent overview of some of the exciting work that's going on currently at Children's. And it really highlights the value of what our partnership with MediGuide and Children's National could provide patients from across the globe. I would encourage participants to offer some questions. We do have a few specific to some of the things you just touched on, Dr. Meany. What is the timeline for engineering each specific cell in some of the studies that you were talking about? You did say that that's one of the big challenges in treating these patients.
Absolutely. So for the 4 immune therapy studies that I presented, 3 of the 4 do require about 6 to 8 weeks from the time of a blood collection to manufacture the T cells. And so that really can be something that requires quite a lot of planning and logistics, but also time for patients where they may not be able to immediately receive that therapy. So one of the reasons we're excited about Dr. Hahn's study is it does take that variable out of the mix if we have off-the-shelf products available. But I think, one thing that we do have experience with from the prior T cell study that we've conducted is how to navigate that delay so that patients are often able to receive some form of bridging therapy. Our collaborations with outside institutions has really been, I think, quite strong so that we can bring patients in quickly, work with the other sites to develop a treatment plan for that interval as we're procuring the cells, as we're producing the cells, and then getting them that cell product as quickly as possible.
Thank you. There's actually another follow-up question regarding one of the studies that you talked about. I know this isn't your study, but regarding the high-intensity focused ultrasound, are there other medications that can be used to maximize utilization of that treatment modality?
So right now, the trial is just using this liposomal doxorubicin product. The advantage of that product is it is an encapsulated chemotherapy, so that the medication is not released into the bloodstream at any significant concentration. It really requires the heat of the HIFU ultrasound within the tumor bed. So right now, that's the one product that we have access to that has that specific encapsulated property, but it will be, and doxorubicin being a very common medication that we use across the board in patients with sarcoma. So it was an excellent choice for this patient population. But I think as other agents are made available, it really wouldn't be restricted just to doxorubicin. So I think for right now, we're looking at that in particular, but hope that we could expand that technology with that particular type of agent.
Excellent, thank you. This is an anonymous attendee who is sending in a question. How many second opinions does MediGuide send to Children's National in an average year? Kara, do you have that?
You're muted, Kara.
Great. Yeah, sorry about that. I would say, and Nicole, Soraia, you may have a difference of opinion, but I think we approached, was it 30 last year? That sound about right?
That is sound about right. Yeah, somewhere around there.
Yeah.
And we get a lot of referrals as well from them. Some cases we are able to accept, some cases when we review either, sometimes we don't have enough the medical records, but about 30, I would say, is the ones that we have completed so far.
Right. And we always, so within our network, we help our members and patients understand which medical center is best for them based on their condition. Obviously, Children's National has, a variety of options. So they're a great fit for most patients who are looking to travel as well.
So this individual was wondering, how can they work with MediGuide to receive a remote second opinion from Children's National? Either Soraia or Carrie.
I can take that, Soraia. So the medical second opinion program through MediGuide is offered through either a patient's insurance program or through their employer. So if they have access to the benefit, they can reach out directly to us through either a toll-free number or through a member portal and request to initiate a case, essentially. Once that happens, they get assigned a dedicated nurse case manager who works with them, throughout the process, guides them, helps them understand, what's coming, expectations, things like that, collecting medical records, and keeping them updated throughout the process. And then most importantly, help them decide which medical center would best match sort of what their outcome goals are. So what their condition is, maybe how quickly they want to turn something around if they're facing like a surgical or treatment deadline. But it's nice that we have the process in place where once a patient initiates a case, they have someone that helps them kind of walk through the process, which is great. And we can provide them at the end a report of the findings, the recommendations from the medical center. And along with that is a phone call with either their nurse case manager or Dr. Malin to ensure that they understand the content and they have the information to bring back to their treating team to make a plan for care.
And what I can add is what happens at Children's National. So once Kara's team prepares that information, then they reach out to our hospital, and our hospital will receive the packaged information with the medical records, with the main questions and concerns from the family. And then we select, sometimes the patient or the MediGuide team already has a physician in mind. Sometimes we are the ones selecting those physicians within Children's National pool of physicians. That physician internally will review all the medical records that were provided to us and will write their own opinion based on the information we received. That opinion, it's a packet. So we, at the end of the day, provide a packet back with the written opinion to MediGuide, and that's when Kara mentioned that's then provided to the client along with the call with their clinical teams, because we want to make sure, given that is a medical opinion, we want to make sure that the patient or the lay audience that might not have any medical or clinical training as background understands exactly what the opinion of our physician is and what is the next steps. We also answer any questions. Sometimes, let's say from that meeting with MediGuide, patients had some follow-up questions. We'll be happy to then work on those follow-up questions and provide answers to those as well.
I think it's a really important point, Soraia. Being able, so in terms of like the relationship part of the process, it's great to be able to have a service that supports reviewing medical records and opining on care and providing recommendations based on the findings. But the option for patients to ask personal questions, I think is incredibly important and sometimes not highlighted enough. So we allow and encourage members and patients who initiate cases to ask very specific questions about what they should be doing next, or just maybe, you know, things that they've been worried about or concerned about that they haven't had an opportunity to address with their treating team. And those questions are very thoughtfully answered by the physicians at Children's National. So thank you for that.
And we value that too. Sometimes knowing exactly what the family wants to know and being very specific on the questions guides us as well as we are putting a report together, because we want to provide the best experience to the patients and give them the answers to their questions. So
absolutely,
we appreciate that as well.
Very personalized touch, and it just highlights and emphasizes the fact that, you know, every question is important.
Yes.
And what is the typical timeline from the time that a patient initiates their relationship to receiving that second opinion remotely?
So it varies, ideally as quickly as possible, and we can turn things around very quickly when we need to meet deadlines. We have the goal with the medical centers, as discussed earlier, is a 10 business day turnaround time. And in addition to that, it's just a matter of the availability of the medical records that help support that process. So collecting the medical records can sometimes, you know, be a bit tedious and be a little bit time consuming, but we certainly do our best and have that great team of local partners in countries, boots on the ground, kind of helping us get that that process expedited as much as possible. So it really is like not a one size fits all, but we do our best to get that information back to patients as quickly as possible.
And then I can add our part as well.
Go ahead.
Sorry, Dr. Malin.
Please.
But once we received that information from the MediGuide team, we pass it to our physicians, which we usually say about 7 business days, but we often return those opinions in a shorter amount of time. Sometimes we say the 7 business days, just understanding that the clinicians are in clinic, seeing patients, on top of that, working on their own research assignments as well. So just giving them the time to schedule a block of time to be able to then review the second opinion and put a good opinion together. But we often are able to deliver those before, let's say, that 7 business days time. And one thing I wanted to mention to you, the communication between our team and the MediGuide team is very, very strong. We have one person in our team completely assigned to MediGuide, and MediGuide has assigned one of their nurses to work with our nurses. So that relationship has flourished, and the back and forth between the two teams works very well. So that saves us time at the end of the day, because we have a very streamlined process, which at the end of the day, the person who wins it, it's always the client, always the patient getting the best service, not only from Children's National, but also from MediGuide.
Excellent. I think we have time for one more question. If I were a patient or a family member of a patient, what is the important information that I need to have gathered to really expedite this remote second opinion?
Sorry, I can take it if you want.
Go ahead.
We can share it.
Yes, we can do that. You can start.
I would say from our perspective, again, remembering that it's a remote medical second opinion. So the providers at Children's National during this process are not going to visually see or assess the patient in person. Upfront, our nurse case managers conduct what we call an intake form. It's very comprehensive, and it highlights all of the history of present illness in detail. So we understand what the patient's story is, but actually, in addition, how they're feeling. So symptoms, what they've tried, what has failed, what hasn't worked, what has worked, sort of thing. So a very, very personalized story. Then in addition to that, obviously, all supporting medical records. So if you are experiencing a condition, a newly diagnosed condition, or if you have been managing something chronically, I think it would be ideal if you wanted to expedite the process, to have that information on hand that we could get uploaded quickly into our system and then share with Children's National. And we have a lot of supportive tools that help us do that in terms of, diagnostic sharing tools and easy ways to upload records. But I would say in terms of timeline and constraint, that is the most challenging part of the process, is collecting that information. So if the patient was to have that at their disposal, it would really make things move a lot faster.
Excellent.
One additional thing that I just added to it that, and we don't have much of that with MediGuide, but with other clients and other patients that are coming directly to us for remote second opinions, which is the reports have to be in English. So we do assist a lot of international, a very large international population. We offer the remote second opinion program to countries outside of the United States. So one important thing is the medical records have to be in English, because we could offer a service for translation. There is a fee associated with that. And we often recommend to patients to get those translated in their home country, get the English translations to us, and that's what our physicians will look to then provide their opinion. So that's an important thing, that we often get a lot of medical records in different languages, and we have to go back to the family and ask them to translate them.
And I know we're short on time, but I think it's important to identify that as part of the MediGuide process, we manage that for our patients. So patients have records in other languages. We manage the translation for Children's National and back again to the patient. So that's a step that we take on as part of our process.
Excellent. Thank you very much. I'd like to thank specifically the panelists, Dr. Meany, Soraia, and Kara. I also want to thank the staff for all of their hard work, both MediGuide as well as Children's National, for helping put together this webinar. And I look forward to the next session. Keep up the good work. And I think we're really pleased with the partnership that currently exists, and look forward to watching it grow in the future.
Thank you all.
Thank you.
Thank you very much.
Take care.
Goodbye.
Take care.